SC Johnson Professional, a family company. Thank you for your commitment to patient safety and excellence in care. In collaboration with University Hospitals Coventry and Warwickshire, this video highlights the importance of hand hygiene in preventing the spread of harmful microorganisms in healthcare settings. Together, we'll explore the My 5 Moments for Hand Hygiene, a simple yet powerful guide that empowers healthcare professionals to reduce healthcare-associated infections and protect those we care for every day. Microorganisms are commonly found on a patient's skin and in their immediate surroundings. Hands are the primary means by which healthcare-associated pathogens are transmitted. These germs can transfer onto the hands of healthcare workers during patient care and may survive there for several minutes. If hand hygiene is inadequate, hands remain contaminated and can spread pathogens through direct contact with the patient or their environment. Therefore, proper hand hygiene is essential to protect patients from potentially harmful microorganisms. Healthcare workers' hands are responsible for up to 40% of healthcare-associated infections, HCAIs, when hand hygiene is not properly followed. Healthcare-associated infections, HCAIs, are infections that develop because of healthcare interventions. This may include medical or surgical treatment or following contact with any healthcare setting. Examples of this are: John is admitted to hospital for surgery. After the operation, he develops a wound infection. Mary has had a heart attack, and she has an IV line put in. She gets a bloodstream infection from the IV line and lives in a nursing home. She has a urinary catheter in place. She gets a urinary tract infection and bloodstream infection related to the urinary catheter. Did you know? There are an estimated 5 million HACIs in Europe each year and an estimated 50,000 deaths from HACIs in Europe each year. The impact of HCAIs on patients are: prolonged stay in a healthcare facility, long-term disability, high personal costs to patients and their families, excess deaths. HCAIs impact on health services through additional financial burden and increased workload and demand on resources. The healthcare setting is divided into 2 virtual geographical areas. The patient zone may be the room or bed space belonging to the individual who requires care and in which their equipment and personal items are kept. The healthcare area is the environment directly outside of the patient zone. It contains all surfaces in the healthcare setting outside the patient zone. Examples include sluice room, nurse's station desk, and shared healthcare equipment outside of the patient zone. Hand hygiene should be performed at the point of care. This is the place where the patient, healthcare worker, and the care or treatment involving patient contact takes place within the patient zone. The concept embraces the need to perform hand hygiene at recommended moments exactly where care delivery takes place. My 5 moments for hand hygiene define the key moments when healthcare workers should perform hand hygiene. The aim is to create greater awareness and understanding of the importance of hand hygiene. The 5 moments apply to any setting where healthcare involving direct contact with patients takes place. Hands should be clean before any patient contact to protect the patient from harmful microorganisms carried on the healthcare worker's hands. This occurs before first contact with a patient, regardless of glove use. Hand sanitizer should be located within the patient zone, or worn on a toggle, to allow moment 1 to be achieved at the point of care. If gloves are needed, for example, to remove a dressing, hand hygiene should be completed immediately before putting the gloves on. This should only occur at the point of care as the dressing removal is about to begin. Examples of this are: shaking a patient's hand, touching a shoulder, helping a patient move, applying an oxygen mask, assisting with personal care, assistance with eating, before checking an IV line and taking a pulse or blood pressure, examination of skin and abdominal palpation. Hands should be cleaned immediately before performing an aseptic or clean procedure, even though you may have cleaned your hands before patient contact for other reasons. This is undertaken to protect the patient from microorganisms, including their own, entering their body during procedures. This is important to stop in the introduction of environmental pathogens to the patient and stops invasive introduction of the patient's own flora. This may be combined with Moment 1, but only if the first patient contact is a clean or aseptic procedure. Where gloves are required as part of the aseptic or clean procedure, hand hygiene should be completed immediately before putting the gloves on. The order of donning the gloves will be indicated in the aseptic or clean procedure to protect the aseptic field and should only occur at the point of care. Examples of this are oral care, suctioning, instilling eye drops, surgical wound care, urinary catheter care and insertion, accessing an IV or enteral feeding system, and taking samples of blood, sputum, and urine. Hands should be cleaned with soap and water immediately after exposure to body fluids and after glove removal. This protects healthcare workers and the healthcare surroundings from acquiring microorganisms from patients. The rationale for Moment 3 is to prevent contamination of staff and ward outside the patient zone, with germs carried in patients' bodily fluids. It is important to realize that even if gloves have been worn during a task that constitutes an exposure risk, once gloves have been removed, the hands cannot be considered clean until Moment 3 has been complied with. Hand sanitizer is not suitable for Moment 3 even if hands look visibly clean, as the risk of bodily fluid exposure requires soap and water to remove potential microorganisms. Examples of this are clearing up urine, feces, vomit, handling waste, dressings and incontinence pads, cleaning soiled equipment or environment such as bathrooms, commodes, and sharps trays, oral care and suctioning, skin lesion care, wound dressings, administering injections, taking blood and urine samples from a catheter, CSU, and emptying urinary catheters. Hands should be cleaned after touching the patient and moving on to another task or procedure. This protects healthcare workers and the healthcare surroundings. The aim is to prevent germs crossing the boundary between the patient zone and the healthcare zone. Hand sanitizer should be located within the patient zone, or worn on a toggle, to allow Moment 4 to be achieved at the point of care. If gloves have been used, for example, apply a dressing to a wound, hand hygiene should be completed immediately after disposing of the gloves, which should be done as soon as the dressing has been completed. Examples of these are after taking a pulse, blood pressure or temperature, conducting a physical examination, and applying an oxygen mask. Healthcare worker hands should be cleaned after touching any objects, furniture, or personal items in the patient zone, even if there has been no direct contact with the patient. Surfaces in the patient zone become contaminated by the patient's natural flora during their time in the healthcare setting. This is removed by environmental cleaning. Hand hygiene after touching patient surroundings prevents the healthcare worker transferring patient flora onto themselves and into the healthcare environment. Examples of this are clearing the bedside table, touching patients' personal items, touching equipment in the patient zone, handling a chart at the end of a patient's bed, and turning off a patient call bell. Hand hygiene must be performed exactly where you are delivering healthcare to patients, at the point of care. During healthcare delivery, there are 5 moments or indications when you must perform hand hygiene. When appropriate to clean your hands, hand rubbing with an alcohol-based hand rub is preferred. It makes hand hygiene possible right at the point of care. ABHR is faster, more effective and better tolerated. You should always wash your hands with soap and water when visibly soiled. Perform hand hygiene using the correct technique and remember to cover all parts of the hands. Hand hygiene saves lives. The WHO 5 Moments for Hand Hygiene Guide helps healthcare workers prevent infections by cleaning hands, before touching a patient, before a clean or aseptic procedure, after body fluid exposure risk, after touching a patient and after touching patient's surroundings. Every moment matters. Clean hands protect everyone.